Channel. This video is about the anatomy of the elbow joint complex. I have written down the contents of my video. First of all, I will tell you about the articulating surfaces which forms the elbow joint. Then I will tell you about the type of joint, which type of joint the elbow joint is. Then I will tell you the ligaments surrounding the elbow joint. Then I will tell you about the nerve and the blood supply surrounding the elbow joint complex. And then I will tell you about the movements that are possible and the muscles causing those movements at the elbow joint. So let's first of all start with the articulating surfaces formulating the elbow joint. Articulating surfaces that formulate the elbow joint complex. I have drawn here the anatomical structure. This one right here is the humerus bone. This one right here is radius. And this one is the ulna, and the elbow joint is formed right here. So at the end of humerus, this structure right here, it is called as capitulum, and it articulates with the head of radius. This structure right here is the trochlea, and it articulates with the trochlear notch on ulna. This one right here where the radius and ulna meet, this one is known as the proximal radioulnar joint. So I will repeat again. This bone is the humerus, this one is radius, this one is the ulna. So elbow joint complex is formed right here. So at the end of humerus there is a structure called as capitulum which articulates with the head of radius. Right here there is this structure at the end of humerus is known as trochlea, and it articulates with the trochlear notch which is placed on ulna. And right here the radius and ulna form the proximal radioulnar joint. So you can see that here in this joint complex there are almost three associations. The first one is between capitulum and the head of radius. The second one is between trochlea and the trochlear notch on ulna. And the third one right here, this association is known as the proximal radioulnar joint. Okay, so these are the three main articulating surfaces or associations that formulate the elbow joint complex. We are now talking about the type of joint. So the elbow joint is a synovial hinge joint. So if anyone asks you which type of joint the elbow joint is, you can simply write that elbow joint is synovial hinge joint. Why synovial? Synovial, that's why, because it is lined by the synovial membrane. And hinge joint because these articulating surfaces form a sort of hinge. So it is characterized as a synovial hinge joint. Everyone now talking about the ligaments surrounding the elbow joint complex. So there are a group of two main ligaments that surround the elbow joint. The first one is known as the radial collateral ligament, which attaches from the distal end of humerus to the head of radius. So this one right here, you can write it as the radial collateral ligaments, and on the other side there are the ulnar collateral ligaments. Both of them provide medial and lateral stability to the elbow joint. The main purpose of ligaments is to provide stability. So you can see this one right here is the radial collateral ligament, and there this is the ulnar collateral ligament. So if anyone asks you which are the ligaments that surround the elbow joint complex, you can simply write as there are two set of ligaments. The first one is the radial collateral ligament, and the second one is the ulnar collateral ligament, and both of them provide lateral and medial stability. Talking about the nerve supply and the blood supply of the elbow joint, starting first with the nerve supply. So the elbow joint is supplied by a set of various nerves which include the radial nerve, ulnar nerve and the median nerve. Because right here at the junction of humerus and ulna and radius, there is a formation of the cubital tunnel, above which the musculocutaneous nerve, which is the nerve of the arm, it branches off and gives off the radial, ulnar and the median nerve. So if anyone asks you about the nerve supply of the elbow joint, you can simply tell them it is supplied by ulnar, radial and the median nerve, which are the branches of the musculocutaneous nerve. Okay, then talking about the blood supply of the elbow joint, as I told you, right here there is a formation of cubital fossa. So the blood supply is from the cubital anastomosis. And this anastomosis comes from the deep and superficial branches of the brachial artery. So brachial artery is the main blood supply of the elbow joint. Alright, so nerve supply is from the ulnar, radial and the median nerve, and the blood supply is from cubital anastomosis, which is formed by the deep branches of the brachial artery. Alright, I hope you got a better understanding of the elbow joint complex. If you have any query, you can ask me in the comment section. If you like my video, give it a thumbs up. I just recently hit 1000 subscribers, so I want to thank all of you for all your support, and keep sharing my videos and keep liking my videos, and kindly subscribe to my YouTube channel Medical Knowledge. Thank you for watching my video. Have a nice day.